Hi, my name is Roumen. Welcome to the Rose Podcast. I have our founder and CEO, Andy Hernandez, here with us. Thank you for taking the time.
Thank you for having me on your show now, apparently.
Yep, thank you. The show. So we wanted to
Yes,
do the show to kind of spread awareness and education when it comes to home health.
absolutely.
There's a lot of unknowns in the industry, and not just in the industry from a patient perspective, but also from a client perspective, rehabs, hospitals, you name it. Family caregivers, the ones that seem to be most involved in the process. So we decided why not do a podcast to educate and fill the heart. So
I love it. I love that we're doing this. I think the market, I think the community, I think the patients, I think the family members above all, because a lot of these patients, the families are involved in their care. And I think it hits them out of left field 90% of the time. They don't see it coming for whatever reason, and they're not educated. And now their parent ends up in a hospital. They end up in a skilled nursing facility. Now they're being discharged. What is that? And in that discharge process, they either got to go to a skilled nursing facility, an assisted living facility. They're going to get DME. What's DME? Medical equipment. Now they're going to get home health. What is home health? Like, it's funny to me over all my years, I mention home health to a lot of people. They have no clue what home health is, right? So the easiest way that I explain it is our service is an extension of the hospital in the home setting. So
100%.
think of the nurse, the physical therapist, the occupational therapist that goes sees you in the hospital, minus the doctor. We provide that care now at home. So we're an extension of the hospital in the home to make sure that you get back or your family member gets back. Uh, Sometimes to 100%, sometimes from 40% to 80%. But we try to improve their quality of life so they can continue, living.
Well, let's actually talk about that. Why home health? Like, why did you start home health, and why would you say what's the difference between health at home versus health at a facility?
Yeah, so great question, Ruben. Home health has been a part of my life at a very young age. My mom had a major stroke when I was 3 years old, pregnant with my sister, and she had a right side deficit. She couldn't work. She was disabled. We grew up on Medicaid, food stamps, welfare. And thank God for home health because home health was a very intricate part of our childhood into my teenage years and into my adult when becoming a professional and being a career. So without home health, I don't think I would be here today. Me personally, forget about what I've done in the industry, but the impact that it had on our family because they helped my mother in some of her hardest moments. My mom passed away 11 years ago, and those final 3 years were very difficult because she was having a lot of falls. She was very depressed. So it was just not a very, very good time for her. But thank God that we incorporated home health in that moment, and she really became very close with a therapist that really changed her mood. Her outlook in life looked a little different. My mom was the happiest she had been in years right before she died, because she started doing therapy. There was a lot of things that this therapist, the impact that she has, and I love her to death. Her name is Kenya, and she was just an incredible person to my mother. My mother treated her like a daughter. And I just saw the impact of that. And I ended up landing in home health by coincidence. I always tell people it was God sent. I started in the industry when I was 22 years old. My brother called me. He had started in a home health agency. And I had worked with him previously when I was 19. He owned a medical equipment company. I was a delivery guy, worked with him for a few years. Then I got a hospital job as a patient transporter at Baptist Hospital, which, by the way, life comes full circle. Now I sit on the board of Baptist Hospital, on the foundation board, and I'm chair counsel at Homestead
It's
Hospital.
amazing.
So just life has come full circle, and I really truly believe God has placed me in this field for a reason because I understand it. I know the impact that it had on me, and I know the impact that we're making in the for families and the community. But yeah, that's how I got my start. My brother called me. Hey, you want to do sales for me in home health? And I did that for a long time. I did that for about 8 to 9 years. Really learned the business, and then I went off on my own. I had an opportunity with a smaller agency in Miami. Uh, Grew that significantly, learned a lot. I learned a lot about operations. And then 2016 came around, and I really wanted to scale at a lot larger level. And I had an opportunity to acquire the Rhodes Home Healthcare. And, I say I'm the founder because when we acquired the Rhodes Home Healthcare, it only has 7 patients. It wasn't really well known in the community.
You've grown it a lot.
Yeah, so my family and I acquired the roads in 2016. My sister Chantal is a partner. My brother Zeus. So we acquired it in 2016, and we've grown it to what it is today. And just a little backstory on the roads. If you're familiar with Miami, the roads is a little area in Miami, South Miami area, down almost by downtown. That's called the roads. A lot of older homes are there. A lot of people actually grew up in that area, so people don't know that. So people that know and they see the roads are like, hey, is your office in the roads? Yes, it was when we first started, but we outgrew that office, and now we're in Blue Lagoon in Miami. But yeah, man, it's been an incredible journey up until now. What we've been able to do, the impact that we've had on our patients, our seniors, families, and then the people that have come through here and that are still here. We have people from day one that are still with us. The Kenyas of the world down in Miami. Jackie has been with us probably almost 9.5 years. She's down in Miami. Jonathan came over with me when I acquired the business. Chantal, my sister, she's been with me through the whole entire ride, which has been crazy. But yeah, I just think we provide such a valuable service that people are not aware of. And I think this is the reason why we decided to do this podcast, is to really get our message out there of the impact that home health truly has. And let's just be honest, people want to be in their home. They don't want to be in a hospital. They don't want to be in an institution. And the federal government's realizing that we're 1/3 of the cost versus a hospital, right? If a hospital stays 3.5 days average, 3.5 days is the average length of stay, and that can be an expense anywhere from $15,000 to $25,000. We're 1/3 of that cost for a 30-day period, in 60-day period. So everything's going towards the home, and if a home health agency is ran efficiently with good clinicians, it's the best possible care that you can get because you're in the comfort of your home.
If you have the right team tied up and
Absolutely.
associated, it's the best possible outcome
Absolutely.
and a lot of better outcomes than even the facilities.
Yeah.
We just kind of wanted to start off with that.
And I want to give a
because
shout out to our head therapist in Miami, John Z. I can
John
never
Z.
I could never pronounce his Zementovich. I think I may have gotten it right.
Can you pronounce my last name?
No, I don't even know. It starts with an A.
Arabajev.
Ravish. But
Abracadabra.
let me tell you about John. John started with me as well in 2016, and John was a big part of our growth in general as an organization. He impacted us tremendously. The level of knowledge that John has, and John came from Cora Rehab. So if you're familiar with Cora Rehab, he was one of the pioneers of Cora, helped them build down here in South Florida, and then he got into home health. But we were so fortunate to get a clinician like John that truly cares about his patients. He is the ultimate professional, but the passion that he works with, and that resonated through our whole entire branch at that time, organization. And we really took off when John really took over our PT division, and our PTAs are incredible. And John's been with me ever since. So I got a lot of love for John, and we wouldn't be here today without John. So I just wanted to mention that and give a shout out to John.
Well, you said it last time. There's a lot of hands involved from beginning to the end of the patient care. So it's kind of important for everybody within the team to be good, not just from the account executives, not just from the billing department, but also clinical and to the foots on the ground. So
it takes
it's
a
key for
village.
everybody.
It takes a village in this space. There's so many people that have to get involved with the continuum of care for a patient, and people don't realize how much it goes into it.
And would you say that that's a focus for you?
Absolutely.
To get the entire team to be on the right level. And tell us a little bit, I mean, the phrase or term Rhodes culture. That's
Right.
a big one for me.
Absolutely.
It's in big plaques in every office. We got little pins on it. That, I think, Rhodes culture strives for that and pushes for that because everybody's got to be on
I'm
the
a
same
big
page
believer
for
that
for it to work.
so we have 4 pillars under Rhodes culture. It's our core values. It's good character, blame no one, no excuses, work harder. And I really believe in those principles, and I put those principles because those are what I believe in. If you're a good person and you're coming from a good place, then everything else is going to fall in line. If you blame no one, then there's no excuses but accountability. You're going to have success, and you have to put in the work. This requires a lot of work. Healthcare requires a lot of work, and healthcare is for a special type of individual. You truly have to be doing it because you really want to help others, and you have to be passionate about what you do because this is tough stuff. This is not easy driving around town all day in the hot sun. Right now, the weather's getting. I had to take a phone call
I love
outside,
it.
and it feels like it's 130 degrees out there. Imagine having to go from patient to patient's home, uh, and just sweating all day, and having to see 7, 8 patients in one day with the Miami traffic or the South Florida traffic. It's a lot, man. So I have a lot of empathy for what these clinicians go through, and the work that they put in every single day. The cost of living is up, inflation's up. There's only so much we can do as an agency too, right? Because our margins are being reduced every year. The federal government has cut back on our revenue, and there's a certain place that we need to live in to even be profitable to be able to provide a service like this. And we're not crushing it like people think we are. It takes a lot because you're paying people that have gone to school for 4 years, 6 years, and they have certificates and they have degrees and they have specialties, and you have to pay for that. And I wish that the federal government recognized the good actors and really not penalize us for all the bad actors that have been in this business.
What would you say, from a patient perspective and even from a clinician perspective? What would you say a lot of misconceptions about home health?
From a patient's perspective, that everything's covered, that he should be getting daily services, and that's not the reality. There's a certain place that we have to live, and we have to be able to.
Insurance runs it.
Yeah, insurance runs it. The amount of money that they pay us, we have to live. We have to make a margin, right? And that's the reality. That's as transparent as I can get. I wish I can give services every single day. I wish I can give a home health aid every single day, but that's not the reality. And if you call Medicare, they're going to tell you you're entitled to all this. But the reality is, if you are entitled to this, and we did this across the whole entire company, we would fail in 2 days. Like we wouldn't be able to afford what they're saying that they're entitled to. It's just to fend them off, and they tell them they're entitled to it. But the reality is, the system's not set up for that.
And a little bit to bring it back to why facility or why home health versus facility. I've come across that a lot of patients think that, oh, when I'm getting home health, it's going to be different nurses, it's going to be scattered. When reality, you get a team. You get the same physicians, the same nurses, the same physical therapists or therapists in general that come and see you and build a relationship with you. And it's kind of funny, the opposite is true when it comes to facilities because they usually have rotating nurses and the patient just showing up on whatever the schedule is for that day. And the continuity of care is simply
I
not
think the
there.
continuity of care is better in home health because it's the same
100%.
person going
Correct.
over that, and we do a really good job of keeping
Correct.
the same clinicians through that, uh, uh, through your care,
Correct.
right? Through your episode, as we call it, because we don't want to make you feel uncomfortable, and we want the best possible outcome. And we feel that the best possible outcome is to give you continuum of the same person going to your home every single
And when
time.
it's the same person, they build a relationship. You tend to feel
Relationships,
more
everything.
different.
Absolutely.
They become almost like a friend or a family
Right.
member.
And they tend to listen to somebody that they have a relationship with, because a lot of success with patients come from their compliance.
Correct.
If they're compliant with the exercises that we're giving them, their medication management, all that stuff, and the keyword's compliant. I always teach this to our account executives. These are the type of conversations you need to be having with your physicians, right? When you're going out and you're talking about our organization, I always talk about painting the picture. Do you have a patient that is non-compliant? Because those are the type of patients that we can help, and it's to what you just mentioned. It's the relationship that we develop with them that we could get them to be compliant because we're in there every other day or 3 times a week. So that's such a great point that you brought up, Roumen, that the relationship is everything because you can get them to do what you want.
And the
from
outcomes tend to be better.
and the outcomes tend to be better. 100%.
Statistics. It's not just
Everything shows it.
opinions. So
Yeah.
I want to ask you, what kind of stories do you think we're going to hear throughout this podcast? Who do you think we're going to hear from? Because I got some ideas. I share them with you.
Yeah, I did this show.
What do you think is going to happen?
I think a lot of the ideas you brought were super interesting. I think we're in a world today where people want to have a personal relationship with the businesses or brands that they're doing business or they're getting services from, and I think it's so important that we share our stories, right, internally from our team, leadership group, account executives, on and on and on from an organizational standpoint, but we want to do some testimonial stuff too, because we
100%.
get great reviews all the time. We get patients sending us emails, letters. So we want to really bring to light the impact that our clinicians are having with our patients, because we want to be able to provide that to more patients, because we want to help more patients hit their goals, and we want to help families through this process.
And it's true exposure. It's exposure from every angle. It's
Right.
exposure from the patient, past and present, the family caregivers, the people that are actually lifting all the hard work and doing while they're working a job, while they're doing a million other things, and now they got to take care of mom and dad
Right.
or dad.
Right.
So I think it's going to be beautiful to get an outlook or a perspective from every angle, because the angle from the clinician is going to be very different from the angle of the patient, and the angle from our account executives is going to be very different than the angle of the accounts that we service, like hospitals, skilled nursing facilities,
Sure.
rehabs, you name it.
Yeah, and I think we're in a trust recession now. You're hearing that term a lot, and people don't trust what they're being sold. They want to have a personal connection, and I think that's the point of creating now our media division at the Rhodes Home Healthcare. I do have a media background. I own a media company. I've done it in a different space, but now I think it's important to do it with the other businesses that we currently own, and I think people want to see who they're dealing with, and want to see the behind the scenes, and they want to see that there's something tangible. It's just not a clinician going out to them or an account executive that they met one time, but who's truly
All the
behind the
hands.
scenes,
All the hands.
you know, pushing all the buttons, all the hands on deck. So I think that's what we're going to do, and we're going to be the first ones to do it.
Yep. And this is actually a term you brought up to me a year and a half ago, maybe over close to 2 years. And I loved it and I memorized it, and it's a part of me, and it just came up to me in my head now. Radical transparency.
Right.
And that's what we're about. We have nothing to hide. And we want to expose the industry. We want to expose home health. We want to expose every aspect of it, the pros, the cons, and everything that we go through and everything that the patients go through. So that's what this podcast is going to be about. We want to educate, uplift, and bring everyone together so there's no confusion, and just shine light.
I love it. And radical transparency, that's Ray Dalio's term. That's not my term.
You
Just
brought
got it
up
out
to
of his
me,
book. Yeah. So I give credit to whoever came up with it. Like, you hear me talk about John Maxwell. I don't take people's, you know, words and use them as my own. But yes, I believe in radical transparency. And if you're going to have a successful organization, then you have to be radical in the transparency and the conversations that we have. And confrontation sometimes is not good,
Yep.
but is needed. And because the only way you can solve issues in the organization is through conflict and resolution.
And be truthful.
And
So,
be truthful. Yeah, you have to be.
um,
So yeah,
Thank you so much for taking the time to join us on our official podcast.
I actually enjoyed being on the other side for once.
Thank you.
Yeah, I
There's
think you
gonna
did
be
an
many more to
excellent job.
come.
Absolutely.
Thank you. And we look forward to the viewers. If anybody has any questions or just is curious about home health, please visit us at theroadshomehealth.com and reach out to us, message us, DM us, follow us. We're here to serve and be there for you. So thank you.
Check out hit the link, subscribe, comment,
Yeah, I don't
share,
know all
like
those
all that
tricks.
stuff.
Yeah.
Yeah, we need you to hit that subscribe button.
Hit that.
We're trying to build a community here. So if you want to continue to see more content like this, hit that subscribe button. Thank you guys.
Thank you.